honorable ex- honorable expert of the sessions, deans, academic directors, faculty members, and my dear students. Good morning, one and all. Myself, Mrs. Vinaya, Associate Professor from Department of OBG Nursing, privileged to welcome you all to this webinar. Ethics are the norms for conduct, so that is distinguishing between acceptable and non-acceptable behavior. So when it comes to research ethics, which is important for a number of reasons, they promote the aim of research, such as expanding the knowledge. They support the values required for collaborative work, such as mutual respect and fairness. So this is essential because scientific research depends on collaboration between researchers and groups. So, to update more on this, we are hosting a webinar on ethical perspectives in nursing research by Parul Institute of Nursing, Parul University. So, today we have with us an expert, Mrs. Shobha K.R., Professor, Adichunchandgiri College of Nursing, as a resource person for today's session. I
Thank you,
request
Vinay.
participants to post questions which they can ask during the discussion. To introduce Madam, Madam had pursued BSc Nursing from Adichunchandgiri College of Nursing, Bangalore, MSc Nursing from NDRK College of Nursing, Hassan in 2009, and currently Madam is pursuing PhD from Lakshmi Memorial College of Nursing, Bangalore under RGHS Bangalore. And Madam is having wide experience of 14 plus years in teaching field, and also Madam had been a speaker for many webinars and workshops, also done many paper presentations in various conferences, also have many publications in national and international journals in her credit. May I now request Madam Shobha to proceed with the session.
Thank you, Vinaya, for your wonderful introduction. So, first of all, Jai
Thank
Shri
you.
Gurudev. So, seeking the blessings of my Param Puja Guru Varyas in our esteemed mart. So, first, I would like to thank our beloved principal, sir, that is Ravindra Sir Raichan, who has given me an opportunity to do this. And of course, special thanks to you, Jaya, that you have been approached me and you gave me this through the sir. So today, ethical perspective in nursing. So it's a vast thing. So anyhow, I'll be starting with this. So later, participants can have their doubts. Shall I start, ma'am?
Yes, ma'am. Yes, ma'am. Please proceed, ma'am.
Thanks, ma'am. Whether visible, my slide is visible.
Noted, ma'am.
It's showing that it is sharing like that. Just a minute.
Okay, ma'am.
PPT little. It's taking time to upload.
Okay, it's okay.
Just 2 minutes.
Okay.
Notification. Just a while. Tab is also not window. Otherwise, I will upload and share. Something is coming. Ma, can you see now?
No, ma'am. Okay.
It's coming now.
Yes, ma'am. But still, it is not in slideshow mode.
I put it, but it's not coming, Jaya. I put in slideshow only. Just a minute. 2 minutes, huh?
Okay. It's done, ma'am. Hello, Shobha, ma'am. Now we can see clearly.
Ma, are you able to see now?
I could see, but now, just now, it went wrong, I feel. So,
2 minutes, ma. 2 minutes, huh?
so before it was seen, PPT
Two
mode.
minutes. 2 minutes.
Okay.
PPT. PPT share ಆಗಿಲ್ಲ. ಸರಿ. ಸರಿ. Vinaya, can you see now?
Yes, ma'am. Yes, ma'am.
Okay, ma. Thank you.
Okay.
Thanks for the delay. Sorry. So once again, warm good morning to one and all. So today I'll be presenting on ethical perspectives in nursing research. So if you see the topic, we have a words like one. If you split, it's we have a ethics, then perspective in nursing research. So nursing itself, it's a vast. You all know that is, and research. Now what we are doing with evidence based. So more or less, it's a totally a big and a vast topic. I just try to touch each one of the concept. I started with ethics, perspectives. What is the role of ethics in nursing research? So today I'll be dealing on that. So today's objectives includes introduction, meaning of such are the words, certain definitions for ethics. So what are the purpose of this ethics in our research, and what are the types of ethics we see commonly? So ethical principles where we are using in nursing research. Then comes certain theories. So everywhere we find a theory. Here also we have a two to three theories. I tell now enormous theories are there which is needed for our nursing research. Just I picked those. Then what are the scientific misconduct? That means where you need to follow this ethics, or what are the mistakes we find during our research. Then mainly few norms, majorly six norms of scientific research I'm going to touch today's. So, introduction. Ethics is a system of moral values that is concerned with the degree to which research procedures adhere to the professional, legal, and social obligation to the study participants. So, dear friends, we all know where research stands. We take our participants, that may be patient, that may be staff nurse. So, all are who are coming under our study. So, ethics, it's a system. It is not a single word or a single phenomena. It's a total system where we start with a morality, that is moral values. Why? Where it bounds or where it covers or where it attached, adhere to the professional. So we the professionals as a researcher we are there. So participants will be there. Both should have a very good, like there won't be any legal issues or there is no social complaints. So this application of fundamental ethical principles to planning, conducting, and publishing of research. So the main perspective or the main role of ethics which stands here. So as a researcher we are going, any enormous areas are there, anywhere you go you need to make one plan for a research. Then you have to implement in the terms that you are going to give some interventions, or you are getting some questionnaires. Then we are going for the publication of the research. The time you start your, or you plan your research, when you perform it, and when you publishing that paper. So this major three areas compulsorily bounded with the ethics. So question comes, what is ethics and what is research? Then what exactly research ethics? Right now, so every time, that's what ethics stands differently for different areas and different populations and different constraints. So for example, if you take historical research, even we should not spoil the monuments. So here nursing research, almost all we are going with both as well as qualitative and quantitative research. So we must be more. So ethical is the most important aspect. So coming to the nursing research, anyhow, we all well known it, but briefly I just cherish it. So nursing research is a research that provides evidence used to support nursing practices. So nursing practices is the fundamental element which has been developing since the time of Florence Nightingale till to the present day. So if you look back, the theories evolution has been started at the time of Florence Nightingale, who is the pioneer of nursing. So, nursing research develops knowledge about health and promotion of health over the full lifespan care of persons with health problems and disabilities, and nursing action to enhance the ability of individuals to respond effectively with actual or a potential health problems. So, we are well known where patients reaches us, that may be hospital, either the clinical or somewhere area. So wherever you do, always we should have a body, that is thorough body of knowledge. Ultimately, promotion of health, any research if you take, we all will see for the significance. Same thing, nursing research. So best example, simple, if I would like to give cannula, how it has in evaluate, our evolution has started. Before they were using only the needles, now we have enormous. So like this, it has a evidence, whatever you perform or whatever you implement, that should have a strong body of knowledge with evidence. The nursing research complement those of biomedical research. Of course, other department researchers are going on. So we used to say, no, so true experimental, we need to only for the drugs. So when we thought or when we start arguing with it, but it's a complement to those biomedical research. Nursing research is not entirely different from others. So, but it has a certain specific qualities and as well as ethics, which is primarily concerned with causes and treatment of disease. Advancement in biomedical research have resulted in increasing life expectancies, including life expectancies of those with a serious injury and those with a chronic or terminal disease. The best example I would like to give here, so cancer treatment. So where chemotherapy right now we have, so before the invention of such therapies, so we doesn't had a that recovery, that is life, increased life expectation. Tuberculosis, if you take today, it is treatable. Maybe our parents or grandparents, they never had such things. So all, but it is not entirely different from other biomedical research. It is a complement. Nursing research is a complement. So next, coming to the word ethics. So what is ethics meaning then? It's a Greek word derived from Greek word ethos. That literal meaning of that ethos word is character. That is, it is a systematic study of value concepts, that is good, bad, right, wrong, and the general principle that justify applying these concepts. So ethics always says what is our behavior or what is that is, it's a value concept, whether good ethics or bad ethics, if it is right or wrong or general principle. The meaning of ethics, that is character. So few definition I just listed out here for the understanding purpose. Ethics definition. So ethics, Aristotle says in 1941, a discipline dealing with what is proper course of action of a man. So always we say, no, when we are judging somebody, if they are well groomed, well approachable, and if they are very soft spoken, we say, yeah, they are good. If we are not finding such, we may give to other judgment. The same meaning it gives, that it's a discipline, always the proper action of each and every man. That's individual. So another definition we have here, it's a branch of philosophy that looks at what is good and what is bad. It is understandable. And another definition, a system of obligation that we have towards others. That means what perception we have towards others. Even it's also known as moral philosophy, which involves systematizing, defending, and recommending concept of right and wrong behaviors. So this is ultimately ethics is a study of principles guiding the good of the individual within the context of social interaction and as well the community. So then what is the importance of ethics in nursing? So we know we are caring, right? So next we'll see. So both, meanwhile, we use purpose and as well as importance of ethics. So if you see the major three concept, the purpose of research in ethics stands. First thing, to protect participants. Participants are those samples we call, no? So they are our study subjects. That maybe they are patients, or society, or even resources and researcher. The second most important need as well as purpose is to ensure accuracy of scientific knowledge. So simply we can't do, we did that this and we are, no, it has a body of scientific knowledge. Then to protect the intellectual and property rights. So intellectual IPR nowadays, it's you all knows, but it is getting a most and most important. You can't steal somebody's knowledge, you can't take somebody's that may be paper or anything. So the major three needs and as well as purpose of this research ethics are, we must use in nursing research this ethics. One, ultimately to protect our protect patients, our participants, and as well as society or whomever you are going to conduct the study, and ensure the accuracy. So there should not be bias. That means you must not give a false information. It must be true. Then you should protect the intellectual and property rights. Who have done a right thing, they has to be bring notice. So one by one, some brief point I just made. So how you will protect the participants or participant society and resources? So you should protect from harm. So best example where you are taking a people for drug trials once after they are trying with the guinea pigs, or for example if the patient may have do not move or do not restrict. So all the things, first and foremost, our need or our principle is protect from harm. We should not do any harm either the participants or a patient, society or resource. Whatever the subject you are taking for your research, you should not make any harm. Second one, you should show a respect. A huge respect must be given. So, in the terms of maintaining confidentiality as well as privacy, so their major role is informed consent. So, which is a big and even vast. Once again, informed consent is most important. Any researcher where any area you are performing. So another concept that is refrain from caution and even undue endorsement when to incentives where you are giving any incentives or you are not giving must be clearly told to patients. So, what is that? Refrain from explanation of vulnerable participants who are vulnerable groups. So, usually when we are using like ensures favors and benefit ratio, that is, risk should be minimized and potential benefit to society must be. It doesn't mean best example. If, for example, if you have taken a study for hot and cold application, few patients may not tolerate the cold application. Few will be very eagerly get the spasms. So how you are going to deal with it. Next, you must have a social value. That's the most important in the first need, that is protection of rights. So improvement of health, knowledge, benefit of the society, or whatever the subjects you are taking, your ultimate goal in your research must be their improvement, health as well as the knowledge. So other things you can't see. In that we have a high social value as well as less social value. So high social value, some of the studies or research which improve, that is use of stem cells to improve the quality of life of Huntington disease patient. So stem cells where we are using. So less social value if you consider, this is an example. So drug studies conducted to obtain data that allows a new drug to compete in the healthcare marketplace, even through existing effective and often that's a cheaper the therapeutics and even already available. So whenever we are introducing a new drug, comparatively with the other already with same action if it is there, so it doesn't get a value. But high social value or your research gets where it is permanent, that is complete treatment, and as well as that is improvement is very much seen. So the second need or the second importance is to ensure accuracy of scientific knowledge. So I told about knowledge. So whatever research you are doing should have been methodologically rigorous. It seems it should have a proper planning. So that is scientific validity. Whatever the research you are undertaking should have a scientific validity. Next comes fair subject selection. Whatever you are selecting the subjects or the participants, both with the inclusion and exclusion criteria, a valid number of subjects in order to project result to the population. So best example, wherever we are conducting, for example, you take a pilot study or some reliability studies. So 5, 6, 10, whatever available we do. But as researcher says, it should have a proper number which will be calculated through the statistical analysis. So always you should go for a fair subject selection with a proper inclusion and as well as exclusion criteria. Also, you must clearly state research method clearly so that another person can conduct advanced study in future by using publication. You have done it, you have make it a proper that whole study. So how your study should give means the knowledge should be grown, not that exactly stop over there. Even do not cross or do not gloss research method should not like falsify, or you should not leave any data improper. Should take actual data for analysis, cannot include somebody collected. So you should not do any report errors. So all should be, you have to be very careful about conflict of interest, and also should not withhold wagging up information. That means I will not give this information, you can't do. So always, whenever you conduct any research, you should keep the data material for 5 years. So how you can boost up your knowledge, that is scientific knowledge, and even data and material should be available to others, that should be shared. So coming to the types of ethics. So variety of ethics, code of conducts we see. So for medical it's different, nursing for everywhere different. But when it comes for the research, we have mainly these three types: bioethics, which governs life sciences like responsible research conduct, environmental ethics, and as well as sustainable healthcare. Then clinical ethics, it's a branch of bioethics concerned with ethical problems at the bedside. So whatever the problems they are facing in bedside or whatever the clinical trials we are taking, so that comes under clinical ethics, but it's a branch of bioethics. Next, coming to nursing ethics, it's a subset of bioethics which is concerned with the study of ethical issues that arise in nursing practice. So before we were not having that anything, whatever the doctor orders we used to do and go, but nowadays where we have started with the practicing ourselves, so we have that. So nursing ethics, so top on the that stands on the top, that is it's also a subset of bioethics, but it is purely concerned with the ethical issues that we see in an everyday nursing practice. So, what are the ethic principles? We know. So, code of conduct also we know. But I thought I will just refreshing the major ethical principles over here. So, we have autonomy, we have beneficence, non-maleficency, veracity, confidentiality, justice, fidelity. Because without these ethical principles, no research will be complete. So coming to the autonomy, if you talk here, it's focusing on self-governing. That is having the freedom to make independent choices, self-determination that is related to healthcare, deals with professionals' willingness to respect patients' rights to make a free choice given that they are being provided with all necessary information and knowledge, not on absolute right expected in some cases. Few cases it has happened, especially in if you see pediatric group, because subject cannot be able to give the full information. We may depend on the parents. So there also with both mother and father we may have a problem. So autonomy is nothing but your subject participant should have a freedom, or they should give you a proper willingness, and we should respect to their choice. That is autonomy. Next, beneficence. It views that primary goal of healthcare is doing good for clients, that is including technical competency, that is client approach in holistic manner. It is look like very old requirement, but good care is equal to good client belief, feelings and wishes, as well as those of the client's family. So difficulty implementing the principle lies on determining, so best make the decision. What you like, patient should be benefited through your research. Of course, you also will get the more experience, but that whatever the care you are providing, if you take a clinical care or any research, good care is equal to it gives you all client best belief, feelings and wishes. Non-maleficency. So it requirement that healthcare providers that do not harm, so to their clients intentionally or unintentionally, even like opposite side of the coin from beneficence difficult to discuss without mentioning beneficence in current healthcare practice right now what we are experiencing. So our maleficence is we should not harm a patient or we should not harm our study subject. Veracity, truthfulness. It's of course it's explanatory. Requires a healthcare provider to tell the truth, not intentionally deceive or mislead client limitation. So in situation where telling clients the truth would seriously harm their ability to recover or would produce greater illness. Usually we feel and we will do. So for example, the diagnosis we will not tell. So right now we have in all corporate setting, hospital and other, they have a separate counseling center. Even though doctor will be there and we nurses will be there, but counseling people will come and everything they will explain and they will tell. So because terminally ill and difficult disorders, when they feel the reaction is entirely different. But thinking that they will get serious, we should not hide the same thing. So veracity, truthfulness, whatever you are doing your research with your subjects, you must be openly truth. That is, they should not hide any such things. So, for example, feeling uncomfortable is not a good enough reason to avoid telling client that truth about their treatment and prognosis, and they have the acquire the right to information. So justice, so it's a well-known word. It's a fair, equitable, and appropriate treatment in light of what is due both persons. Recognizing and giving to some will deny receipt to the others. For example, when you are performing any research, like 10, if you are taken 60 samples, definitely 50 samples will give you all the data, whatever it is needed, and 10 may be late. So you can't make a hurry. With the same others, leaving them, you can't take a data. That is, it should be fair and equitable for everyone. So usually the individual obligation to be faithful to commitments made to self and other in healthcare, which includes the professional's faithfulness or loyalty to agreements and the responsibilities accepted as a part of practice of the profession. That is mainly we see that it's a concept of what we can say accountability. Usually they must obtain or they have to. That is which will support the accountability. Next comes ethical theory. So ethics has made we know what are those things, what is needed. So few theories says the difference. So an ethical theory provides a framework within which the agent can reflect, that is acceptability of actions, and can evaluate moral judgments and moral character. So mainly ethical theories we look in teleology, deontology, and as well as institutionalism, ethic in caring. So few just I just briefed those theories. So ethical theories, they are the framework, they will give such one framework that we have to follow and we have to adapt in our research. So teleology means it's look like the consequences of an action in judging whether the action is right or wrong. It says whatever you are performing or whatever the work or interventions you are doing with the samples, whether it is right or wrong, you should decide. Deontology says that proposes that the mortality of a decision is not determined by its consequences. It emphasizes duty, rationality, obedience to the rules. So whatever you are being taken informed consent and you have assured that then you are going to do this and that. So you must adhere. As a researcher, you must adhere that. The difference between theology and deontology can be seen even each approach is applied to the issue of just one example I gave here to differentiate teleology and as well as deontology. For teleology approach, in case of any abortion, how that is saving the mother's life, the end of the consequences justifies the abortion. Means we have to save the mother's life, we will perform. That says teleology, means which is right or wrong. But what this deontology approach says, you should consider any termination of life as a violation of the rule. So do not kill and therefore you should not abort. Understanding the difference between these two, one says right and wrong. So another one says whatever it may be, you don't have a right. So the researcher must be very careful when they are selecting the samples and when they are performing their research. So then next one, this institutionalism, that is summarized as the nation that people inherent, that is know what is right or wrong. That means they must know. Everyone must be aware that under what circumstances they are undergoing, and even what is the right is not even the rational thought. For example, the nurse inherently knows it is wrong to strike a client. The nurse does not need to be taught this or to reason it out. For example, that is the simple meaning. So, certain things what we have studied already in our, that is scientific body of knowledge, what we say. So, you must know these things that you should not do, and it has to be practiced. Institution, what you have learned, it should be carried out through your studies. So the preceding, like three theories, are based on the concept of justice. Next, ethic of caring. It is based on relationship. That is, caring is a force for protecting and enhancing client dignity. Caring is a central importance in the client-nurse relationship. For example, nurses use trust telling to affirm client as a person rather than objects and to assist them to make choices and find meaning in their illness experiences. It's my personal experience. So even though doctors are coming, they are prescribing everything. So the major role played by a nurse in a clinical setting. She will hear the things from the doctors, she will implement to the patient. The same reactions she hear from the patient and she will be conveying. So when you are performing a research, you are a total pack or you are totally bounded with the all such things. So our primary motor is caring. Whatever the research you are undertaking should not harm anyone. It should have always beneficial to the subjects. So just two lines I just thought to put on code of ethics. So code of ethics means it's a standard. It's a written list of professions, values, and standards of conduct. Conduct means our character or our framework that we must follow for decision making. General statements offer guidance, even periodically revised, not legally enforceable as laws, but consistent violation indicate an unwillingness by the persons to act in a professional manner and license can be suspended, even we can stop it. That means even though all our nursing standard ethics, so INA ethics, even ICN ethics, so we have a lot of ethics, code of conducts, so we should not violate even though they have not been approved as a gadget, that is as a rule, but this violation of such rules will have a against, that is ours can registration can be cancelled. So it's well and fine when you are performing a research, definitely you should go through with the your following of all theories and understanding you should carry. So, what are the scientific misconducts? So, I said about what is ethics, what is nursing research. So, what are the theories we should go? What are the, what I can say, that principles. So, which are the conditions we consider as a misconduct, or which are the areas this ethics should be applied? First one, fraud. For example, research when you are conducting, invention or fabrication of data. For example, so you will not go to the research area, you will maintain or you will prepare something that's a fraud. Plagiarism. Plagiarism is nothing but I had a same research. My friend also performing more or less the same. So I will copy the data, ideas, text. That is without saying, yeah, you can use it, telling that you are quoting his name that I have taken a source from that. When you are not acknowledging, that comes under plagiarism. So copying data or even ideas, thefting also problem. Next comes piracy, that is copying. That same study, I have an experience. People will do just taking up and just they'll perform. Just a minute. Vinaya madam, are you able to hear me?
Yes, ma'am. Yes, ma'am.
Okay, okay. So next comes submitting, publishing the same paper to different journals. So once conducting, we will do some copying. Next, we will make research. Publishing when you go, no. So one journal, if it the same study, will be submitting to variety of journals. That's again a misconduct. So next, not informing a collaborator of your intent to file a patent in order to make sure that you are the sole inventor. For example, usually it applies for the what we can call as engineering or something, research areas where they're finding out something. So two, three friends will do, but one friend will not quote their names, he will put his name. Again, it's a misconduct. Not mentioning, but somebody else, you want to do some favor for them, their name, if you're keeping with your publication, also wrong. That's also misconduct. Trimming outliers from the data set without discussing your reason in paper. For example, 60 samples you have taken or 100 samples you have taken, 80 samples only you are putting the results. So what happened with that particular 20 samples you are not discussing. Again, that we call it as a trimming the outliers. So that should not be done. Using an inappropriate statistical techniques in order to enhance the significance of research. For example, so even I too experienced with sample size estimation. So easy going, we will see you should not do, always you should select an proper statistical techniques so that you will get a good result. Next, bypassing the peer review process and announcing your results through a press conference without giving peers adequate information to review your work. For example, it applies for some more business, what we call that areas. So without primary distribution and discussion, directly they will announce. So simply if you apply for us without showing to our respective guides, we are publishing our dissertation of thesis. That is the misconduct. So another one, conducting a review of the literature that fails to acknowledge contribution of others. So we are taking some reviews. So whenever you go through now, you will feel or you will find a lot of difficulties. Somewhere there are theft. So like that you should not do, because again you will be in a trouble when you are ultimately submitting. Next, stretching the truth on a grant application in order to convince reviewers that your project will make a significant contribution to the field. Means simply you are dragging. We know that is nothing is there in that study, but you need to assure that you should get a grant, that is financial assistance. Giving the same research project to two graduate students in order to see who can do it is the fastest. It is happening at the PG level that we will give the one whichever I need, will finish early, I will take. No, that should not be there. Even along with the researcher or the person who is performing research, so overworking, neglecting, or exploiting research students also should not be done. It also again consider against our ethical perspective, and it will be considered as a misconduct. Making derogatory comments and personal attacks on your review of author submission. So whenever you submit for publication, if you get such comments, again it's a misconduct. So making significant deviations from the research protocol approved by the review board without informing the committee. It is happening in the publications. So we need at any cost, they may say us third volume, fourth volume, next 6 months after, but we need it because of some other reasons. We will tell without their knowledge, we will make a changes. Then not reporting an adverse event in a human research experiment. Usually, true experimental studies will have a lot of, because everywhere when you go for the research, it doesn't say that always you should get a positive outcome, even though negative outcomes also are coming. So in order to improve or in order to escape, we should not hide that particular negative outcomes. That is the point meaning. So adverse event, if it is there, if you are not reporting, again it's a misconduct. Then wasting animals in research. So guinea pigs, we know everyone we well versed and anything they will make is. So you can't do like 5 ml injection means 5 ml only. You can't give a 3 ml. Oh, now I can't give this. Again, you should go. No, whatever the treatment are, you should not do any wasting. So this is for bioethical or bioethics research. Then exposing students and staff in biological risk. So it has happened with the COVID, what when we had. So I'm proud to say that our staffs and students truly they are being, but unnecessarily it was a needed thing we went. For example, so without PPT kit, if you are sending, it's again a misconduct. Exposing neither the researcher or the staffs were biologically like a radiation therapy. If one of your student you have, you need to study some radiological examination, you can't expose, so that thing should be considered under misconduct. Then rejecting a manuscript for publication without reading it all. Whenever we are going and giving some booklets to some or those people, so they will be rejecting, even not touching. Again, it's a misconduct. Then supporting someone's work and criticizing somebody's work, ragging or experiment as so that you will return out. Nothing, rigging. Sorry, that is rigging means nothing you could achieve it. Deliberately overestimating and even clinical significance of new drug in order to obtain economic benefits. So pharmaceutical companies that they will do, you can call it as a bribe only. So deliberately giving like high clinical significance of the drugs will be shown because it has to purchase or it has to spread all over the world, but that quantity work will not be proper. That is overestimating the clinical significance. For example, when you calculate hematocrit 0.2 or 0.5, so they will give a highest significance that so that can circulate among population. So this is how we go. Next, coming to the ethical review committee. So ethical review committee, it is also called as was institutional review boards. So every institution we have this, that is, we must have, because post graduation research works are going on, we must have a committee in each department and each college of nursing. When clinical trials also, they also have an ethical committee. So simultaneously, synonymously, we use this ethical review committee or institutional review boards, we call it as. Mainly the purpose of establishing this ethical review committees in order to maintain ethical standards of practice in research, ensure protection of subjects, research workers from harm or exploitation. That we should protect the same subject or research workers, and also to provide reassurance to the public, that is, protect researcher from unjustified criticism. So how much you work, that sometimes they may not notice or they may not look it. So this and all things will be watched and performed and checked by ethical review committee or institutional review boards. So what is the major role of institutional review boards? It's to determine whether the rights and welfare of the subjects are adequately protected and whether the study adheres to sound ethical and scientific principles. So this review board will properly performing means whether it has taken care of the samples or as well as the study researcher with the proper ethical and scientific principles. Next, procedures for ethical clearance. So just one example, that is why ethics and how day to day we are using. So always ethical board, I told ethical principles, I said you will prepare informed consent and all other things. So after all this, then you need to go for an ethical clearance of your research study. So fill ethical clearance form and even attach the proposal what you have, what are the tools you have prepared, and informed consent forms and information leaflets. Everything you will take this and you will submit to institutional review board, and also fill ethical clearance from the attached proposal. Next, when ethical clearance is granted, so the data collection can come according to be approved. So what is the role? Ethics we know, ethical board will be there, institutional ethical committee will be there. It is mainly made to look after both researcher and as well as samples welfare and well-being. So the procedure is you should get a ethical clearance for any research anywhere, either the hospital, either the community. So then this and all things you need and it should be clear. So once if you receive the ethical, then only you can go for other things, or you can start the your methodology, that is data collection. So the concept of ethics or ethical principles, if you take, so simply it has not been. We have one best example means how they have studied fetal growth, 1 month, second month, third month, fourth month. Meanwhile, we also have, just I'm briefing it out. We have it's in the international landscape. So these are the few people or few committees, they started thinking of nursing research ethics or codes and even regulations. So first one is Berlin Code, that is in the year 1900. So it much emphasis or much useful for like beneficiaries and autonomy. Autonomy and beneficiaries, previous slides I talked to you. Then guidelines of human experimentation. So what are the things we must follow when we are considering that are we are performing or we are giving intervention to the individual, we have to see are the population, that is, so that comes both beneficial and autonomy. Guidelines for human experimentation, so we know how we need to for select the sample and what are the things we are going to fill it out. That is established in the year 1931. That is the most important in informed consent. There only we have a lot of classification, again it will take 1 hour. So any of informed consent is the major or the most important component we must obtain. Next, Nuremberg's code. So Nuremberg code 1947, if you see one code na one story behind that, even Belmont report, declaration of Helsinki, so they all had some problems. So next, Council for International Organization of Medical Sciences, CIOMS guidelines are being developed. Then International Conference on Harmonization. So this is the major theorist or the incidents made a stepping stone towards the frame of research ethics. Just here I am quoting Belmont report because that had the most used and even very much useful for all our researchers. It stands with respect, beneficence, and justice. So this Belmont report established in 1978. So treat others as an autonomous agents, allow people for choice. Beneficiency come acts as a kindness that go beyond charity and duty, like various obligations like do not harm, promote good. Ultimately, all whatever the principles we spoke, it comes under Belmont report. Story also says history something else. Then justice, treat the people fairly without any discrimination. We must treat. So next comes the norms of scientific research. What are the norms and what are the things we have to look into that? The first one, valid research design. When you are going to make one research, so that too scientifically if you have. So first is you should have a valid research design. Whatever I want, I can't do. You have to take the relevant theory and as well as methods and prior findings. Then only you can go. So the first norm of scientific research is valid your research design. Next, competency of researcher, whether how much capable you are to carry out the procedures. For example, I may interested and I know very well. Okay, better example I'll give. So general ward staff nurse will go for ICU procedures. It is not possible. So whichever it is, your things nearby, we have to go. Then competence of a researcher, whether how much capable they are. Then identification of consequences, that is assessment of risk and as well as benefits. So selection of subjects. So here also appropriate to the purpose of the study. So I'll come consequences. Now COVID is going on. We all need to perform on a COVID, right? Next, yeah, because almost in spite of this many problems, still people are walking without mask, not sanitizing. Still cases are going high. So few of outside countries now nil, zero corona cases. That means you have to see first thing you should use a proper research design. You should see the researcher capacity or capability. Then identification of consequences. So how you can well explain or well you can assess the risk and as well as the benefits. Then selection of subjects appropriate to the purpose of the study, representative of population that will benefit from the research and appropriate in number. So, whatever the subjects or samples you are collecting, whether your research is fulfilling all their needs, you have to search. Out of six norms, four norms is in this page. Valid research that you should be used, should have a competency of a researcher, then identification of consequences and as well as selection of subjects. So next, fifth voluntary or thing is informed consent. Informed consent is very important. It should obtain before the study beginnings without undue or without any threat or inducement to the somebody who is coming under your study should be like voluntary. They have to give your all. They should not agree with your bribes. That means sometime it will happen, not with everyone and every case, or something that you will tell, yeah, will feel. No, they should feel to be your what we can call it as samples. Compensation for injury. For example, anything happens during your research, that is, federal law requires that subjects be informed about compensation but not require compensation. So this is another headache. So they'll say that I came, I'll get. But you must be clear in that whether as a researcher you are going to give an any what we call it as like a loss or injury feed, you can say. So usually, if you see one research ethics perspectives, the public's perception of research, its benefits and its risks, is shaped by the way research is conducted. I don't know. This is the outline I gave. What is ethics and how far we must be aware and how we have to use it. But each area of research will take different shape, different frame of what we call it as our ethical frame. But it has to be shaped by the researcher himself or herself. So coming to our India, Indian Nursing Council has published the Code of Ethics for Nurses in India in the year 2006. So the Code of Ethics for Nurses is critical for building professionalism and accountability. Also, it considering the vital in any area dealing with human beings, including nursing research, because they represent values, rights, and responsibilities. So that's a major concept what I taught you today. So these are my references. So this is I just touched all needed things with the perspective of ethics in nursing research. Vinaya madam.
Thank you, ma'am, for an excellent deliberation. So you have covered all the aspects, the theories, and like measures to enhance the ethical values, mainly about the code and regulations, uh, different codes and regulations, which has been by different bodies and all. So it was a really a thought-provoking session for even all the researchers who are a beginner or even a experienced person. So now, shall we move on to the discussion? If
Yeah, sure,
anybody,
sure, ma'am.
okay. If anybody having any queries or things to contribute, points to contribute, you can.
Yeah, please.
There is no much question. So, from my side, can you please tell me a take home message for the young researchers who are just beginning with the research in their academic career?
Yeah, definitely. When they are starting, na, even when I started, we had a confusion. First thing will be confusion with our area of research. So better you decide an area. For example, if you are going for the clinical research, the committees are entirely different. The approval what you need to take is different. So if you go for the school studies, again setup changes. For example, government school, if you want to approach, you need to go for BEO. So first, you define, reframe your study area, what you want to go. Then you make more on that. Then you make a point. So how, what? Then comes Gantt chart. You will prepare one schedule so that you can perform. So before, because when we started this plagiarism, we never knowing. But when we start using somebody's slide word, also we must quote their name. Otherwise, it's a
Yes.
big blunder. Nowadays, we can't do so. So
Yes.
young
Yes.
researchers even still me many more to go. We must be well aware of that do's and don'ts and what are the positives and negatives of that particular. So always take a best topic what you can perform well. So if you don't know, going that is knowing the core is much important. Moreover, you should develop a positive attitude. Sometimes what happen in the middle of the study, they may be hectic and fed up. They feel that they can't continue. So such things as a researchers, we must be thoroughly well prepared before going to the research area. So definitely, once we too feel nursing research already in a high, so another young researcher comes, they will reach to some more high level. I think so.
Yeah. Expectation also is increasing day by day.
Yeah,
The
now it's a
challenges
trend we
also.
must. Otherwise, it's of because everywhere it's an evidence based. Whatever you do, you should have a evidence. For example, if you take diabetic insulin injection, two variety. Why? What? When we start learning in such a way that definitely there will not be any duplication, there will not be any issues. At least patient will get a better care, and we too will be satisfying with our modality of care. I feel.
Okay. Any more you wanted to say, ma'am?
Nah, it's fine. It's a very beautiful experience with you. You have given, and I hope because this ethics and nursing research brought two areas, so I try to cover it
Yeah,
up. If
ma'am.
it is an useful, it will
Yeah.
be thanks from my side, and it will be good if you are benefited with this. And thank you. I would like to say thank
Yeah,
you.
sure, ma'am. Sure. Okay. Yeah. Yeah. Thank you so much, ma'am. So, behalf of Institute of Nursing, Parul University, I take this opportunity to thank Mrs. Shobha Kea for being the resource person for the webinar and sharing your valuable time and accepting our invitation and knowledge, sharing your knowledge too. Then, my heartfelt thanks to Dr. Ravindra Hechen, Principal, Parul Institute of Nursing, and the whole HODs, all faculty members for the timely support and cooperation. And also, I extend my gratitude to the IT department of Parul University for the technical support and all my students for the active participation. Once again, thank you all for the cooperation. Have a nice day. Thank you, ma'am. Thanks a lot.
So once again, thank you, Vinaya, and thank you, Dr. Ravindra sir. So thanks a lot. I have shared my PPTs. If any queries, you can drop my email ID to them. And anyhow, thanks for your invitation. Hope I have been useful to you. Thank you.
Yeah, sure, ma'am. Thank you, ma'am.